Let's learn about the details of infection control. We have seen COTI, CLAPSI, and WAP. Let's learn about surgical site infection now. Surgical site infection could be either superficial or deep or organ space surgical site infection. Let us see about what is superficial SSI. It's of course within 30 days post-operation. It involves the skin and subcutaneous tissue, and any of the following can be positive, that is purulent discharge or culture positive, or reopening following signs of inflammation, and diagnosis by the primary surgeon. While in deep, it involves 30 to 90 days post-operation. It involves the deep soft tissue, and any of the positive thing might be positive, that is purulent discharge or culture positive, or spontaneous dehiscence or reopening following signs of inflammation, and abscess or deep infection. While organ space SSI occurs 20 to 90 days post-operation, it involves deep layers, and any one of the following is positive, like purulent discharge, culture positive, abscess or deep infection, and evidence of organ involvement. What are the objectives of the strategies to prevent SSI? It includes to reduce the inoculum of the bacteria at the site, optimize the microenvironment, enhance the physiology of the host. In relation to risk factors, it is classified as either patient-related or pre-operative or operative. And diabetes is one of the patient-related factors for post-operative surgical site infection. The pre-operative goal will be to control the serum blood glucose level, reduce the glycosylated hemoglobin to less than 7% before surgery, and post-op maintain the post-op blood glucose level at less than 200 milligram per deciliter. Smoking, now nicotine delays the wound healing, so smoking should be avoided. Encourage the smoking cessation within 30 days before the hair removal technique should be by clipping, not by shaving, and pre-operative infection should be treated. Surgical scrub should be done. Skin preparation should be done by proper antiseptic, preferably chlorhexidine. And then antimicrobial prophylaxis should be given on within less than 1 hour before the incision. The surgical skills and techniques are the procedure-related risk factors, asepsis and operative time, and operation room characteristics such as temperature, pressure, humidity are other risk factors. Regarding antimicrobial prophylaxis, I said before, it should be administered within 1 hour of incision to maximize the tissue concentration. Once the incision is made, delivery to the wound is impaired. Duration of prophylaxis should be it should be stopped within 24 hours after the procedure, and for cardiac, it should be stopped by 48 hours before after the surgery. To decrease the selection of resistance and contain costs and limit the adverse. A surgical safety checklist to reduce the morbidity and mortality should be followed for this. The surgical skill and technique are play a key role. It involves gentle traction and handling of the tissues, effective hemostasis, removal of the devitalized tissues, obliteration of the dead spaces, irrigation of the tissues with saline during long procedures, use of fine monofilament suture material, wound closure without tension, and adherence to principles of asepsis. The 7S bundle to prevent SSI, it includes safety, screen, showers, skin preparation, solutions, sutures, and skin closure. The pre-operative recommendations to prevent SSIs, it includes antiseptic showers, hair removal, skin preparation solutions, antibiotic prophylaxis, hand decontamination, nasal decontamination, and mechanical bowel preparation. There are WHO, CDC, and NICE guidelines for the same. WHO guidelines advises patients to shower with antimicrobial soap before surgery, similar to the CDC and NICE. Then the hair removal should be done by clippers, not shaving. Use LT clippers on the day of surgery. Then use alcohol-based antiseptic solutions based on chlorhexidine. Then antimicrobial sealant should not be used after surgical skin preparations. Either by scrubbing or the hand decontamination should be done with an antimicrobial soap and water or alcohol-based hand rub. Operative recommendations include have a glycemic control, then wound irrigation. There is insufficient evidence regarding wound irrigation, but consider intraoperative irrigation of deep or subcutaneous tissue with aqueous iodophore solution. Surgical hand gloves, again, it should be it's amongst the intraoperative recommendations. How there are insufficient evidence as per WHO guidelines, but double gloves is recommended by NICE guidelines. Then by nasal decontamination should be done for high risk surgeries, and mucoration 2% ointment is recommended for same. Patient hemostasis should be maintained using warm devices, maintain a normothermia, and gowns should be worn like sterile, disposable, non-woven or sterile woven drapes, and surgical gowns should be used during surgical operations. Hand decontamination should be done using alcohol-based hand rub or antiseptic surgical solutions, and wound dressings should be followed. That was pre and intra. Post-operative recommendation includes change dressings at regular intervals. Topical antimicrobial agents for wound healing by primary intention should be followed. However, it should not be discontinued in the presence of wound drainage. Then dressing for wound healing, don't use any type of advanced dressing or standard dressing. Do not use usual and gauze. Use an appropriate interactive dressings. Debridement, then do not use usual and gauze or enzymatic treatment. Specialized wound care services should be a structured approach to care. To summarize, it should be a multimodal strategy to prevent surgical site infection, which involves active surveillance, multimodal interventions, correctly and timely given antibiotic prophylaxis. Normal thermal should be maintained, normal glycemia, chlorine based alcohol handcuffs should be used for hand decontamination, nasal mupiricin for nasal decontamination, and surgical hand antiseptics should be developed. These are the formulas for calculating the CORTI rate, VAP rate, CLAPSI rate, and SSI rate. The benchmarkings are adopted from National Health Safety Network or from International Nosocomial Infection Control Consortium, which are as follows. Then that was about the hospital-acquired infections. Let's learn about the foodborne illnesses in the immunosuppressed patients. It involves Salmonella enterica, Aeromonas, Vibrio infections, Streptococcus. Now, again, to repeat, the first principle of the infection prevention is to adapt to consider that at least 30 to 50% of all infections are associated with patient care practices such as use of catheters or vascular access lines, therapy in support of pulmonary functions, surgical processes, and hand hygiene surgical and sanitary preparations. So compliance, however, is less than 40%, especially the hand hygiene, which is the single most effective measure against the 5 core components of the hand hygiene strategies includes have a system change for hand hygiene with alcohol-based hand rub at point of care and access to safe continuous water supply, soap and towels, training and education, observation, feedback, reminders in the hospitals and hospitals. The 5 movements of the hand hygiene should be stringently followed before, that is before touching a patient, after touching a patient, before and after surgical procedure, or a procedure that involves blood and body fluids, and after touching a patient. There should be a multidisciplinary approach for infection control and recognize, explain, and act accordingly. It's and have a state or country epidemiology program, have an international surveillance system, financial bodies to support the infection control system. Patient safety promotion should be emphasized, and then healthcare systems such as hospital, ambulance services, nursing homes should be involved actively in this infection control and quality healthcare in the new millennium. Multitask activities, multiple partners, multidisciplinary team approaches, and multiple strategies could help us in our fight against hospital acquired. This involves, again, to conclude, system change, education, monitoring for performance and feedback, and reminders.